So now I'd like to talk about the actual programming of the pneumatic compression device. The optimal is this pump here, and there are several features that I'm going to show you in terms of how to program. All right, so we've plugged the device in the wall in a standard 3-prong outlet, and now I'm going to turn it on. There's a little switch in the back of the machine that we flip, and you'll see the display light up. And this is how it looks when you or a patient turns the device on. You'll see in the left-hand corner will be the number of minutes of treatment. The right-hand corner will be the maximum distal compression measured in millimeters of mercury. And then down at the bottom left is which program we're going to use. We have a choice of 4 programs. So we're going to start down here, and I'm going to show you how to actually program the machine, because there are limited things that a patient will be able to do once it's locked, and we're going to unlock it and set a program. So the first part is to press these arrows here that are on either side of the word select at the bottom left. You want to press them simultaneously and hold them, and it just beeped, which signaled that it's ready for a password. The password that you're going to use is underneath the pressure. There's a plus and a minus sign. You're going to press the minus sign 4 times. Now, if this is a brand new machine, the first thing it's going to ask you is, do you want to switch to zone mode? It also might ask you this question if you've programmed it via a PC. The answer is yes, because we are going to be doing zone programming manually. So you press the start button, and now you will see 4 columns of numbers. These correspond to zones of compression in the appliances. Starting at the far left, this is the distal-most 3 chambers, and then the next 3, and going proximally another 3, and the far right is the most proximal 3 chambers. So each of these numbers represents the maximum distal compression of each of those zones. And this is set in a gradient. There's no way to do a reverse gradient with this machine. It will not allow you to program it incorrectly. So what that means is if you want to increase the distal number, you have to increase it first. The way that you scroll between the zones is to use the treatment time plus and minus buttons. So you can use either button, and it will take you to each of the zones. And let's say that I want to increase the proximal pressure. This is the pressure that is closest to the trunk. So if I press the plus sign under pressure, it's going to increase the numbers, but it's going to stop at a certain point because I can't change the set gradient. So the maximum that I can go at this point is this far, and if I want to go further, then I have to reset all of these numbers higher in order to get this number higher. So I'm going to scroll back to the distal zone, which is now set at 45. I'm going to increase this to 50, and then I'm going to scroll back and increase each of the other 3 zones correspondingly. If you want to, you can just hold the plus sign down and it'll just go. And the last zone, I could go as high as 41, but I'm going to keep the limit at 40 because we like to keep the abdominal pressure or the thoracic pressure at a lower amount because it's more comfortable for the patient to breathe. So now I've set the amount of pressure. The other thing that I can set is which program, and you have your choice of 4 programs. 2 of these programs have the pre-therapy option. So you can do pre-therapy plus sequential, sequential, pre-therapy plus peristaltic, or peristaltic. And just to explain what each of these are, the pre-therapy program allows 10 minutes of compression at the very beginning of the cycle that is only in the trunk region. So if you're using the pants, it's going to be compressing the chambers around the abdomen and the upper thighs. And if you're using a jacket appliance, it's going to be compressing the chest. So basically what we're doing is we're following the principles of manual lymphatic drainage by clearing the proximal part of the body before we clear the extremity. So I recommend using the pre-therapy function. One thing to notice is that you cannot set the amount of pressure for pre-therapy, because that is standard at 40 millimeters of mercury. That is the maximum amount of compression for pre-therapy. But then when the pre-therapy is complete and you go into the rest of the cycle, then it will go to the 50 millimeters of mercury distal compression. So I would say the program that I use the most frequently is the pre-therapy plus the peristaltic. So I'm just going to scroll down using the select arrow, and you can use either one to go either direction. And now that I've programmed the amount of compression and the mode of operation, I'm going to press the start button, and that saves my program. So now you see the screen display has changed. Here's our maximum distal compression, which is set at 50, and on this side is the amount of time. This is as it will look to the patient at their home, or as it will look to you when you first turn it on in the clinic. Now you know how to change the programming, but the patient will not be able to because it's locked. What the patient can do is they can change the amount of time, and they can also change the pressure downward only. If you feel the patient needs more compression, you will need to go through the programming sequence that I just illustrated to increase the maximum compression. To set the time, you can use the plus and the minus buttons underneath treatment time. And what's nice about this is if it's already set and the patient is using this and we decide we're going to use it for a shorter period for whatever reason, this will count down and it will automatically deflate and turn off the program at whatever time you set. The other nice thing is that let's say that you have someone who's very inflated and they need a lot of treatment. So you can turn it up to 90, or if you continue to hold the button, it will now say hold. And what that means is that the pump will run indefinitely until you turn it off manually. To go out of hold, you just press the minus. What will happen is the machine will remember the amount of time. If you program it a couple of times, it'll just stay at that amount of time. It usually takes a time or two for it to get, remember the cycle. Let's say that you've got a patient who's going to use it 90 minutes and they're feeling some sensitivity, and so they don't want to have as much pressure as has been programmed. Let's say instead of 50 they want to go to 40. So they could just press the minus key and bring the pressure down to 40. What will happen is the machine will administer the program at the lower pressure, but once the device is turned off and back on again, it will revert back to the settings of 50 millimeters of mercury. So if a patient is consistently changing their pressure downward, that's a reason for them to have it reprogrammed. You'll notice that if it's set for 50, I can press the plus key, but nothing's going to happen. So that's a safety feature that allows you to lock in the maximum amount of pressure for a patient treatment. I'm going to also talk a little bit about a few operation details. And I'm going to connect the air hoses so that you can see how this works. Okay, so now I have these air hoses that I'm going to plug into the ports. And it really doesn't matter if you're using two of the air hoses, which goes into which port. The only time it matters is if you're using just one hose bundle, which would be for the Comfy arm sleeve, which only treats one half of the body. If you're using the other appliances, the Lympha Pants, the LymphaJacket, or the pod, you'll be using two of the hose bundles. So to plug it in, you just push it straight in, and you'll hear a little click. Same thing on the other side. The lettering press goes on top, but you don't press it when you're inserting the hoses. That's what you do when you're removing them.
Show it to me one more time, just nice and slowly. There you go.
Sure.
Again from the lettering.
Okay, so you notice that the lettering is always on top, and you don't want to press as you're inserting it. You want to just hold it, push straight in until you hear the click, and then to remove it, you press and pull it out. For home use, I usually recommend that the patient just leave the hoses connected. And in some models, there's a little pin, much like you'd use with a computer, where you can secure it so that it'll just stay in. So I want to show you a few operation features when you're actually using the pump. So it's turned on, it's programmed, and all you have to do at this point is to press start. So I'm pressing the start button, and what it's doing is it's inflating the chambers in the appliance with air. You can see that it's on pre-therapy, so it's showing you the amount of compression, which is 40 millimeters of mercury maximum compression. The time is set at 90, so it's going to count down. It'll take about 3 minutes for this appliance to fully inflate with air. So when a patient first uses this, they're going to say, I don't really feel much, and that's true, because it takes a few cycles for it to fully inflate and for them to feel the actual compression. Let's say that you want to stop the program prior to the countdown, because this will count all the way down to 0 and then automatically deflate. Let's say the patient needs to use the restroom. At this point, you can press the pause key, and what that will do is it will deflate the appliance automatically. It will suck all the air out so that it's easier for the patient to remove the appliance. And then what will happen is it will actually have paused the program so that after the patient resumes, it'll resume with the amount of time remaining that they need. So it's still deflating here. Another thing you can do, so see here it says it's got 89 minutes left because we deflated after 1 minute, so if they go back in, they can press start again and it starts right where they left off. Now, let's say that someone presses this button twice. So to demonstrate that, I'm going to start it again. So now, instead of just pausing it, I'm pressing it once and then again. And what that does is that just stops it without deflating. So I don't know that I'd recommend that because it's a lot harder to get out of the appliance when it's full of air. And if that happens by mistake, it's very easy to fix. All you do is start it again and then press once, and that will deflate. If this needs to be turned off for an emergency reason, you can always use the switch at the back. So you have a lot of options to stop this. And in a real emergency, in California, if there were an earthquake, I tell my patients, just unzip the appliance and get out of it. So I'd like to show you the Lympha Pants garment or appliance that works with the Optimal. This is a 24-chamber appliance, and what's really nice about it is it's very adjustable. So you can see on the sides, you have the ability to choose one of these 3 zipper settings. And on the bottom, there are some zippers so that you can set the heel and give the foot a comfortable dorsiflexed position. So since my model is very petite, I'm going to go ahead and set this up, and I'm going to use the smallest zipper setting. It's much easier when a patient gets in and out of this if it's zipped part way. And what I find is that I usually do it to about the knee level. So I've done this side. And I'll wait and set the heel zippers when she's actually in the appliance, because then I'll be able to conform it to her heels. I'm going to go ahead and kind of fold this over a little bit and then bring it like so. And what this will do is it will give her an easier time to climb in. I tell patients it's a lot like just climbing into a sleeping bag that has legs on it. So I'm going to bring my model in now. If she were wearing shorts or if she were barefoot, I would use stockinette liner to provide a barrier between her and the inside of the appliance. We do clean this between each patient. We need to sterilize it for hygiene purposes. But also, this is a cleanable vinyl that patients at home can clean with soap and water. And it's nice to have a little clothing or cloth between the skin and the inside of the appliance. So I'm going to have you sit right here on the edge of the bed. And then go ahead and just bring your feet on the bed. And bring this foot over and just in and in. And with someone who has range of motion difficulties, you can actually unzip these all the way and help them in it a little bit more. But she's pretty limber. So now you'll notice that here's where the edge of the garment is at the crotch. So I'm going to invite her to scoot down, because we want this to go all the way in perfect to the crotch. Now you can lie down, and if she were putting this on herself, she would pull the zippers up while she was still in a seated position, but because I'm assisting her, it's easier for me to assist her when she's lying down. And this is a new appliance, so it's a little stiff. Let's see. After these zippers have been used a few dozen times, it starts to be a lot smoother. As you can see, there's plenty of clearance between her axilla and her chest and the superior border of the appliance. We don't want this to cover the breasts. We don't want it to go up into the axilla. But the trade-off would be that if she had genital swelling, then we may want to unzip this a little bit, or do something so that she can get all the way in. You want to just make sure that people are positioned in a way so that this is treating them in the most optimal way. And you can put your arms down. And are you comfortable? Do you want the pillow over your head a little bit? There we go.
Thank you.
Great. Okay, so this treatment is done with patients lying down. Some of my patients who have shortness of breath or difficulty breathing, we might elevate the head of the bed slightly, but this is not very effective in a seated position. As we go down to the feet, I'm going to now adjust these zippers. And she's right in between two of these heel zippers. So what I'm going to do is to do the more distal zipper, kind of scrunch it, and you can kind of see how I'm just sort of putting her heel right here in this pocket. And then that will allow this part of the appliance to bend up so that her foot can be in a dorsiflexed position. It's much more comfortable to have the feet in dorsiflexion than if they're down in plantar flexion. And the pillow here can help to keep it propped up. And when the device is actually running and everything's inflated, you'll be able to see. Sometimes we'll even double a pillow. And at home, patients might do this on a couch so that the edge of the couch can kind of help to prop the feet. So I'd like to point out that there's a feature here that has a zipper, and this could be used for patients who have catheters, because obviously you don't want the catheter to be compressed underneath the appliance. We're not going to actually go through a treatment here in the interests of time, but you may want to come back and double check and look at the position of the feet and make sure her body's comfortable during the treatment. So now that we've finished treatment, I'm going to show you a few tricks, and so you can help me unzip this. And for your patients who are less mobile, a way that I like to do it is to open these all the way and go ahead and bend your knee and just set your foot, and on this side as well. And then lift your hips, and you can just easily pull it out from the patient. And that way, if they have mobility issues, it's a quick way to help them get out. So this is the LymphaPod, and this is the bariatric appliance that is used with the Optimal that is optimized for LymphaPod. And I wanted to point out a few features before we have our model come inside the appliance. The first is that we have some straps that can be attached to some little buckles here. And if you thread these through, what they will do is they will allow you to thread them to the end of a piece of furniture or something, so that when a patient is getting in and out of this, it's going to prevent it from migrating. So it'll hold it in place. A few other things to mention is that there are two designs of the pod. The hoses can either be on the left side or they can be on the right side. And that's important, especially for home use, because if patients are positioning their device on a particular side, you want to be able to have them get in on the other side. So you want clearance. Also, there are a number of zippers that you can use on the front that will help to increase or decrease the girth of the appliance. And this one in particular has a little strap that you can buckle, because what can happen is once it inflates, you want this to be buckled down, because otherwise it may cause the zipper to migrate upwards. There are also zippers on the back side. As with all of the LymphaPress garments, you want to make sure that the writing is on the upside, on the front of the garment. Also, these can unzip completely. And you'll see that there is a little symbol here for where the patient is to put their foot. You definitely don't want to have feet protruding out of the end of the garment, because then the feet will not receive compression and they could potentially become swollen. Another thing that's unique about this particular appliance compared to the Lympha Pants is that in addition to having 40 chambers instead of 24, it has additional chambers that come up between the legs. And there's a section here that can be unzipped and removed, which is significant if you have a patient who has, say, long legs or short legs and a big abdomen. This allows you to configure it so that you can compress all of the areas that are needed. So I'd also like to point out that we have a whole separate device that is used with the LymphaPod appliance. And the reason why it's different is because instead of the 12 to 24 chambers that we use with the Optimal, the pod has 40 chambers. So we need a different motor, a different innards in this device, if you will, and it doesn't work so well with the regular Optimal. This is the Optimal that is optimized for the LymphaPod. So I just wanted to point out that there are two different Optimals, and you want to know which one you're using with which appliance. So we're going to help Alyssa get into the LymphaPod. To do that, what I want to do is to make it as easy as possible. And I can even unplug these hose bundles so that she has even more room to get in. So go ahead and sit on the edge and gently move one foot over. You can actually bring it, and hold it there. Perfect. Now you can bring a foot over. Great. And like with the Lympha Pants, you want to come all the way into the crotch. And you can see that her feet are a little bit long, so I'm going to have you scooch out just a little. That's perfect, because you want the heel right here. Okay, so you can lie down. And I love these zippers. These are great zippers. Real easy to operate. And I think that that's important for bariatric patients because many of them have mobility issues, and so it makes it so much easier. So I'm going to just zip this one up as well. So I want to just point out that she's perfectly positioned here. We have good axillary clearance, and it's not going over her chest or breasts. So this is exactly perfect. Now I'd like to demonstrate how you're going to connect the hose bundles, because if you decide to disconnect these to make it easier to get in and out, plugging them together, you want to basically just insert until you hear a click. And to detach these, there are some little rough areas, some raised plastic areas. This is the area where you squeeze and pull. So I'm going to demonstrate that again. You push them together, and then you press on the raised plastic areas and pull. This is fitting her well, and I'm just going to reposition the pillow here at her feet, and then we'd be ready to do a treatment. So a note on programming the Optimal that's optimized for LymphaPod is that it's not recommended that we use pre-therapy with this particular machine. And again, just a reminder to not exceed 40 millimeters of mercury compression over the abdomen. So this is the Comfysleeve, or we often call it the Comfy arm sleeve, and this treats one side of the upper body. So this would be used for someone who has a unilateral arm and torso swelling. I want to point out that this can be used to treat either side of the body, and that there are different side adapter pieces that are different sizes. So if you have a very large patient, you're going to want a bigger one, and then they have smaller ones as well, and they come in left and right. So for this patient, we're going to be treating her left side. So this is a left-sided adapter. What I will do is go ahead and zip the adapter in so that it forms a sort of jacket. The other thing that's useful to do is to extend the straps fully, because it makes it easier to put the jacket on. Before I have this patient put the jacket on, I'm going to take this chamber and make sure that it's not folded in, because this is the chamber that is going to inflate up against the axilla and specifically help to clear that area. So before I have Alyssa put this on, I'm going to get a piece of stockinette, because she's wearing short sleeves, and even though we are going to sterilize the garment between uses, this way it's not making contact with her body, and it's more comfortable and more hygienic. So she's going to place her arm inside, and then this will come around the side of her body. And there's a piece of Velcro right here that helps to hold it. And if you affix both of these Velcro closures, then you can take the strap, which is where the zipper is, and you can go ahead and pull the zipper up. At that point, you can pull the straps to tighten them. And you want it to be snug, but not overly tight. And this particular adapter is a little large for her, but the beauty of the appliance is that it will inflate to fit her, even if it's a little loose. Now, if she were doing this on her own, she would be able to use her hand, and at home obviously she probably wouldn't have stockinette, but then she would be able to operate the zipper with both hands. So for treatment purposes, we're now going to go ahead and zip this up. Go ahead and sit down. And I'm going to get a pillow to put under your arm. So I'm going to put this pillow under your arm, and this treatment may be done sitting up or lying down. It doesn't really matter. I think it's patient comfort, and I think the arm position has to do with patient comfort as well. Although some patients may perceive more compression with their arm in different positions. And some patients who have stiffness or arthritis might choose to move their arm a few times throughout the session just to shift their body position so that they don't feel stiff at the end of the treatment. The other thing I want to do is to make sure that this appliance is up, positioned correctly at her axilla. Here are some other things that you can do to customize the treatment. Before putting on the appliance, or it can be unzipped and inserted, you can use ribbed foam to help to break down fibrosis in any part of the arm or torso. And this pad could also be used to conform to the torso. Obviously, we don't use these between patients. So these would be for her use alone. And the other thing that I often do to customize is to use a towel, or you can even use those little beanbag pillows that you find in airports, neck pillows, help to conform this to the shoulder area, because otherwise it could be up around her ears and it might be not be as comfortable. So I'd like to point out that this particular Comfy Arm appliance is just a 12-chamber appliance, so it only uses one hose bundle. And that hose bundle needs to be inserted in the right-hand port. The left-hand port needs to be blocked. So it can be either blocked with a little plug, like so. The other choice would be to use a hose bundle that has little plugs in the end. The port obviously needs to be occluded because otherwise there'll be air coming out of it and the device won't operate properly. So I'd like to point out that this particular hose bundle has the little computer pin. And so if you want to use this, you would screw it clockwise and then you wouldn't be able to take it out. So this is just another way of securing it. So I'd like to show you the LymphaJacket now, and this is probably used less often than the Comfysleeve because the people who would be treated with this would have bilateral arm involvement plus the torso. So I'm going to help Alyssa into the jacket. Okay, and you can see that there's a piece here that's very adjustable. I'm going to show you another trick. If you have someone that's really tiny, like Alyssa, you can actually just zip this without the adapter, and that'll make it nice and small. Conversely, if you have a patient who's very large, there are expanders that can be used. And I'm going to have you turn towards me. You can see that there's a zipper that goes down the back. So you can actually zip in another panel here. And I prefer to use an expander in the back over having the garment stretched wide with the expanders here, because that way we're getting more treatment on the chest and less on the back. So again, it depends on the individual patient, but my typical patient, I'm usually wanting to treat the front more than the back. Okay, so I'm going to zip this up. Let's see. Okay, so we're going to zip this up. And to do this, you want the zipper all the way down. And then I usually hold the zipper and stabilize the bottom, and then it will easily zip up. If Alyssa were going to do this herself, she would be able to unzip the arms. Now, if you have a patient who has bilateral hand involvement, they're going to need assistance getting in and out of this, particularly out of this. And if it needs to be stopped in the middle of the program, they're not going to be able to use their hands. So usually what I'll recommend with patients for home use is if they have one side that has less involvement in one hand, to either keep it slightly unzipped, or it's possible to actually go in and plug up some of the hoses so that they don't inflate at all. So those would be alternatives for giving her hand a little bit of freedom if that was needed. So we're going to zip this up and zip this, and then we're going to secure these. As she sits down, I want you to notice that her axilla, her real axilla, is up here. So if you sit down, I'm going to just bring this up a little bit. And then you can see that this is up around her ears. And it will inflate here, which won't do much if there are swelling on the top of her shoulder. So what we can do is use a bolster or a pillow or a towel. Here's an example of a towel that can be placed around her neck. My personal favorite are those little buckwheat hull pillows that you can get for your neck or at airports for on the plane, and that conforms very nicely. You can also use pillows to help position a patient and make it more comfortable for their arms. Technically, it's not necessary to elevate when you're doing pneumatic compression, but some patients like to do that just because that position is more comfortable for them. So after she's comfortably in the garment, then we can attach the other hose bundle. And that way she's not tripping over it as she's getting in and out of it. So one way to disconnect the hose to allow the patient to get in and out more easily is at these connectors. But these are a little bit weaker and less resilient than these. So I would actually recommend doing it here at the device itself, because I have had these more fragile connectors break in the clinic. As you're setting up the degree of compression to use on these pneumatic compression devices, I would turn your attention to the Guide for Medical Professionals. And in particular, there's a table here that will be very useful to you in giving some guidelines and parameters for levels of compression to use with different types of patients. So now that you've become acquainted with the LymphaPress Optimal and appliances, I'd like to encourage you to try them out yourself. Play with them, get in them, try it with the pump. I would say that if you don't have edema, you're going to be more comfortable with the lower compression settings. I'd also like to introduce Pat O'Shaughnessy, who is the founder and co-owner of Paradigm Medical, and that's the distributor of LymphaPress in Canada. And Pat is able to help you if you have any specific questions, and she has many, many more resources. Also, I'd like to point out the handouts that go with today's presentation. We have a lot of written material, and there's a lot of good information here, so I'd encourage you to check that out. So thank you so much for opening your minds and opening your hearts to a new form of treatment that's sure to benefit you and your patients.